breast reduction is just as it sounds, making the breast smaller. Now that can be a very modest amount of reduction, and it can be very large at times. Sometimes people have actually several pounds of breast tissue that needs to be removed. It's sometimes covered by insurance, or at least they will assist with some of the coverage. The cost, including operating room anesthesia, depends upon the size of the reduction and how long it's going to take. That can be from around the upper $8,000 range to low $12,000 range. So what will make the difference in that cost? It's going to be time, because a larger reduction is going to take more time to do. That utilizes more resources, more medication, more anesthesia. And also the thing that takes more time is often if it's a bigger reduction. If it's smaller, someone's going from, and this is small, a double D, to a C, that's not a big reduction. But if you're a G or a J or something like that, and you're having a reduction, that's bigger. And we know it's going to be more work for the surgeon. We know it's going to take longer, and it's going to eat up a lot more resources. Insurance coverage, if it's available to you, you have to go through a number of hoops to see if you're going to be covered. What an insurance company will do is they are going to look at your height and your weight, the size of your breast, the anticipated amount of a reduction. How much does the surgeon actually think they're going to be removed? And then they're going to factor in if you've been through the other things they want you to do. Have you been on anti-inflammatories for a certain period of time? Have you been to other physicians like a physical therapist or a chiropractor? Had manipulations? Have you had weight loss to try and affect that? And we see people who just can't get through all of those hoops, that they just don't get coverage, even though they truly do have back pain, neck pain symptoms. It has been shown that it really doesn't matter that much the size of the reduction to get relief of symptoms. That the criteria that are put out there, people can have smaller reductions and still get improvement in those symptoms, which is great for the patient, because not everybody wants to be tiny. Some people just want to have, they want to go down a couple cup sizes, but they don't want to go to just flat. So if you're someone who does not have insurance coverage, or you're willing to step outside your insurance, for that. We see that quite a bit. People have an insurance company that perhaps they just don't want to stay within their network. They're looking for maybe a different quality or a different type of physician that would perform it. What are you going to look for, and where is the cost going to come into that? When we put the cost out there, we're talking about operating room, anesthesia, surgeon, post-operative visits. So you want to make sure that if you are comparing us to somebody else, you're comparing apple to apple. Because often you're not going to get that. And then you're going to find people, just in all lines of work, you're going to find somebody who's going to offer you a cheaper price. Now, because they're offering a cheaper price doesn't mean they're also giving you the same product. Doesn't mean they're not, but you have to really be wary of that. Mostly what we find is people are not getting the same level of service, and they're not actually comparing the same quality. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.